Today, I'm going to go over your upcoming shoulder surgery. Most of you are likely having rotator cuff repair surgery, but the video applies for most surgeries that we're going to do in the shoulder. The first thing you need to know about is, what time is your surgery? You are going to get a phone call the day before your surgery to tell you the exact time. Most of the shoulder surgeries are done on Thursday, so usually you'll get a phone call on Wednesday afternoon to tell you the time of your surgery. If your surgery is on a Monday, expect a phone call on the Friday before that Monday. The surgery itself is done outpatient, meaning you'll go home after surgery. The surgery is done arthroscopically, which means we use a camera called an arthroscope and we make very small incisions to do the surgery. Normally when we do your shoulder arthroscopic surgery, we use approximately 3 to 5 incisions about this big, fairly small. If we're working on the left shoulder, you'll typically have 1 incision in the back, a 2nd incision in the front, and 1 or 2 on the side. That would be the typical scenario. Again, they're very small incisions, usually 1 or 2 stitches on each incision. After we do the surgery, we will put a bandage, a big bulky bandage on your shoulder. The bandage stays on for 2 days and that will be written down for you. 2 days after surgery, you may remove the bandage and get your shoulder wet in a shower. We don't want you to take baths or submerge your shoulder in water, but a regular shower is fine 2 days after surgery. After you take your shower, you do not need to put a big bulky bandage on anymore. All you'll need is small band-aids for the little incisions. Any band-aid will do. After the surgery, it is expected that your shoulder will be swollen. That's completely normal and expected. In order for us to do the arthroscopic surgery, we must fill your shoulder up with saline fluid so it will be swollen. We do want you to ice the shoulder after surgery when you get home, and you want to put ice on it as much as you can for the first couple weeks. That will decrease the swelling and make it go away. For most people, the swelling lasts about 2 weeks. It's not uncommon after surgery you might get a bruise on your chest or a bruise on your arm. If you get a bruise, do not be alarmed. That's completely normal for some people. Before surgery, as you may know already, you can't eat or drink anything after midnight the night before your surgery. So if your surgery is on a Thursday, after Wednesday at midnight, you should not eat or drink anything. The only exception to that, if you take blood pressure medication in the morning, we do want you to take your blood pressure medicine on the morning of your surgery with a small sip of water to get the blood pressure pills down. The blood pressure medicine is the only medicine we want you to take. You do not need to take any of your other medications, only blood pressure pills that you would normally take in the morning. Other than that, you should not eat or drink anything on the morning of your surgery. This includes water, juice, coffee, tea, milk. No, you should not eat or drink anything other than your prescribed blood pressure medicine that you would normally take in the morning. The morning of the surgery, I will come say hi to you myself and I will ask you which shoulder we're working on so we always get it correct and do the correct shoulder. The surgery itself normally takes us less than an hour, usually about 40 minutes or so. After surgery is done, I will call your family to let them know that you did very well. We also normally take pictures of your shoulder that we will give to you afterwards to show you the inside and what we did. Make sure to ask the nurses for the pictures in case they forget to give them to you. Again, this is outpatient surgery, so you'll go home after surgery. After surgery, we want you to come back and see us approximately 2 weeks after surgery. When you come in to see us for your preoperative appointment, you should make your follow-up appointment at that time for approximately 2 weeks after surgery. That's when you'll come in and we'll remove those stitches that we put in. The next thing I did want to share with you, if you want to take a shower the morning after surgery, you can do so, just don't get your shoulder wet. So keep the water below your chest. That way you can take a shower, or at least a partial shower, the day after surgery. You may begin driving whenever you feel safe to drive. Ultimately, that is up to you. When you feel safe to drive, you may do so. We talked about making your follow-up appointment. The second thing is that we will send in a prescription for you for pain medicine for after surgery. The medical assistants will discuss this with you when you come in for your preoperative appointment. The medicine that we send in is typically a narcotic medicine, and those medicines can sometimes cause constipation, so you may need to get something to help you go to the bathroom after surgery if you're taking those pills. Next thing about the pain is after surgery, or actually before surgery, the anesthesia doctor will normally do what's called a nerve block. They normally do this right before surgery. You will meet the anesthesiologist the day of your surgery. They do a general anesthetic and put you to sleep for surgery, but they also normally do a nerve block. What they do is they numb up your shoulder. It's a one-time needle stick to numb up the shoulder so that after surgery you're fairly comfortable. The anesthesiologist will explain this to you on the day of the surgery. Hopefully this video helps you with any questions that you may have regarding your upcoming shoulder surgery. Obviously, if you have any problems, feel free to come into the office and see us. We'll see you for your shoulder surgery. Have a great day.